Senator Hassan.
Oh, thank you, Madam Chair, and to our ranking member. And I'll just echo what you just said and what Senator Murkowski just talked about. It's work we need to do, and I look forward to working with our colleagues on it. I want to thank all the witnesses for being part of this hearing today, and I want to start with a question to you, Dr. Wilkins. The pandemic has certainly magnified the disparities in access to care for people of color all across the country, not just in cities, but also in rural areas, including many places across my home state of New Hampshire. Studies show that people of color in rural areas are less likely to have access to primary care, and they are therefore less likely to have a trusted medical professional in their community to rely on for information and care during this pandemic. We have to do more to ensure that people of color have access to primary care, which is obviously important during this pandemic, but it's also necessary for preventive screenings and early diagnosis of many life-threatening medical conditions. So, Dr. Wilkins, how can we ensure that people of color who live in rural areas have access to trusted primary care providers?
Thank you, Senator. I think this is a really important point. We saw this early on in the pandemic that individuals who had symptoms and needed testing were being told to contact their healthcare provider.
Right.
Well, if you don't have one, then who are you contacting? And how does that work? And so, the delays and the lack of access due to that, I think, are really important. But we don't have enough primary care providers. We need more. And we also need to acknowledge that you don't have to be a physician to be a primary care provider. So we need to make sure that nurse practitioners and physician's assistants also have the opportunity to provide that preventative care, the preventative screening, and be a front door for access to care. Again, we have not taken a full advantage of community health workers as an access point, as people who are great communicators and can actually link to and improve the uptake of care that we're not seeing in so many communities. There's been a lot of talk about telehealth, and I'll just point out that at Vanderbilt, we also saw a dramatic increase, really proud of the great adoption of telehealth during the pandemic. But when we disaggregate that data, again, by race, ethnicity, language, and zip code, the communities who are most likely to use telehealth are wealthy and well-educated. So even though we saw some individuals in rural communities, some urban racial and ethnic minorities using telehealth, it was not at the same rate, and we need to be prepared for what telehealth looks like for everyone, because it is not all the same.
We have to get connectivity to everybody, and it has to be what they can afford.
I think it's beyond connectivity. Yeah. So people have devices, they use their smartphones, but having to type in all the information for insurance, and if you need an interpreter to be on the line, connecting a third person, lots of challenges with that. Are you in a room where you actually can be by yourself in a crowded home and have a private healthcare visit? There are lots of things that we have to consider there.
That's very helpful. Thank you very much. Ms. Williams, I want to turn to you for a question. Earlier this month, I wrote to the Departments of Justice and Health and Human Services pushing for improvements in vaccine access for individuals with disabilities. I was pleased to receive a response that highlighted plans to investigate claims of discrimination and provide technical assistance to states and individual vaccination sites. However, I know that information about such resources is often not accessible to those who need it most. And I know you discussed this a bit in your answer to a couple other questions earlier, but Ms. Williams, what further steps should the federal government take to ensure that all vaccination sites and registration portals are fully accessible for individuals with disabilities?
I'm really glad that you've asked this question. It's something I think we need to consider, particularly as members of Congress look for another response bill to this crisis, is we need to ensure that states and federal responses to the pandemic really account for the needs of individuals with developmental disabilities and those needs of folks who aren't getting the equitable access to vaccines. across the nation. As I noted in my testimony, they are some of the folks who are most impacted by this crisis. And we actually have entities throughout our communities, entities like state councils on developmental disabilities, university centers on developmental disabilities, and protection and advocacy agencies that are able to go into institutions and ensure that folks are getting equitable access to care and equitable access to vaccinations. They are equipped and have, over the last year, rapidly stood up virtual platforms that really do serve the needs of and the voices of individuals who have been impacted by this crisis. And so as we think about future responses, I would ask that you all consider including additional support activities authorized under the Developmental Disabilities Act and the Bill of Rights to ensure that these entities that exist across our nation in support of people with disabilities, that they can continue to serve them at this moment of crisis.
Well, thank you very much. And I know, Madam Chair, I am over time. I will just say it's also going to be important that we provide people with disabilities the kind of information they need so they can report violations and that they can do that in a straightforward way. And the other point I would make that follows up on Senator Murkowski's point and that of Senator Baldwin and others about the maternal health disparities we're seeing is, given how big these disparities are and given a relative dearth of information about the impact of vaccines on pregnant people, we need to make sure that we are addressing those disparities and getting vaccines to people for whom it is safe and answering their questions about the impact on pregnancy. Thank you.
Thank you. Senator